Hi, Dr. Hagmeyer here. This is video number 3 in our adrenal fatigue, chronic fatigue series. The last video we talked about the importance of the adrenal rhythm. We talked about the best way, the best method to assess your adrenal rhythm. We also talked about the number one mistake that people who can't sleep, the number one mistake that people make when it comes to sleeping, the supplement that they take or the approach that they use to have better sleep and how that really doesn't address the problem. Today I have two important things I want to share with you. Number one is I want to talk to you about the salivary testing used in our office that really helps us properly assess the adrenal imbalances. And finally, number two, I want to talk to you about why your cortisol levels, if you tested them through your blood, why they came back normal, which again, in many cases is extremely deceiving and frustrating for so many people. So one thing you have to understand is that when it comes to health, we are not either healthy or sick, okay? We could be anywhere along those two pathways. And for many people who have fatigue and brain fog and sleeping problems and hormonal imbalances, when they go to the general doctor, that general doctor may run tests looking at your adrenals. And what they're really looking at is the end stage of those diseases. They may be looking at Cushing's disease. They may be looking at Addison's disease. They may be looking at thyroid disease. And if your blood work is not as bad as those people with the diseases, you're going to be told that everything is normal, okay? So it's like diabetes. You may not be a full-blown, full-fledged diabetic, but you could be a pre-diabetic. You could have blood sugar dysregulation. You could have functional hypoglycemia, okay? You could have some sort of blood sugar dysregulation, but you may not be diabetic. Hopefully that makes sense because years ago, we didn't have this thing called pre-diabetes. You either had diabetes or you didn't have diabetes. Well, the same thing applies here. So coming back to the testing, many people suffering with adrenal fatigue, again, go to their general care doctors, their general care practitioners, and they run the typical laboratory tests and maybe a test for the thyroid, and again, they come back normal. So again, unless you're suffering with that severe case of adrenal dysfunction, like diabetes, everything is okay and nothing's wrong. Well, at this point, what does your general practitioner typically resort to? Well, you probably know. They're probably going to now prescribe to you some sort of anti-anxiety medication. They're going to prescribe maybe Xanax to you, something to help you sleep. They're going to tell you to eat better and exercise. And now you're going to spend the next 10 years of your life suffering, going from one doctor to the next doctor to the next doctor. In fact, the average patient that I consult with has actually been to over 10 different doctors and still don't have any answers, okay? So if that's the case, I recommend that you contact our office. We'll guide you through this frustrating time. We'll determine the right kinds of tests that you need and really the best test that's suited for you based on the symptoms that you're experiencing. Sometimes your problem is just your adrenals, and sometimes it's much more complicated. It's a whole lot bigger than the adrenals. So if it's just your adrenals, and let's talk about that for a moment. If it's just your adrenals, you need to have a special kind of test that provides a more accurate assessment of your cortisol levels as well as your DHEA levels. We're going to want to look at that rhythm and how they can become imbalanced throughout the day. Now, if this is the case, I typically suggest that you test your adrenals at specific times of the day that correlate to how those adrenals will pump out those hormones in a pulsed fashion. So that means you're going to do a morning fasting level between 6 and 8 a.m. You're going to do another saliva test between 11 and noon. You're going to do another one between 4 and 6. And then you're going to do your last saliva collection between 10 and 12. And these times are very important because this is going to give us a very good overview of how your cortisol levels wax and wane and how they fluctuate throughout the day. If you've had your cortisol levels tested and they were normal, that doesn't necessarily mean that you don't have an adrenal problem. Again, a blood test will miss that pulse rhythm every single time because it's only looking at one time of the day and it's missing those 3 other intervals at which those adrenals are pulsing out those hormones. The best way to do this again is a 4-sample saliva cortisol test that will really just shed a whole new light on fatigue and many of these other problems that you're experiencing. It'll help explain, for example, why you are fatigued in the morning or why you can't settle down at night. It'll also help us understand how cortisol and low DHEA levels are contributing to any kind of male or female hormone imbalance because DHEA is your precursor to your male and your female hormones. So again, if you have any changes to your DHEA, if they're too low, that can go on to affect your male and female hormones. So again, with a lot of people that have, they're told that they have low testosterone or low progesterone, Instead of correcting the precursors, doctors often just jump to giving people testosterone or giving progesterone, when in fact the problem may be coming back to the adrenals. So again, low levels of DHEA may explain why you're mentally fatigued. Low levels of DHEA may explain why you have a low thyroid. Again, another area that's often overlooked. Low DHEA levels can explain low testosterone, low progesterone. If you remember from this video, the one thing that I would really stress to you is that DHEA is one of your several anti-aging hormones. And if it's imbalanced, it's going to contribute to many other glands not working at their fullest potential. Okay, so there you have it. If this is something that you want to have tested, or you've had tested maybe in another doctor's office and you just want a second opinion, use the Contact Us form on my website, drhagmeyer.com. Fill out your name, fill out your email, fill out the best way to reach you. Someone from my office will get a hold of you, they'll contact you, and then what we can do from that point is really discuss the next step, okay? So I'm Dr. Hagmeyer. I hope you found this video helpful. I hope this information helps you find your way back to having new energy and just better, vibrant health, okay? Take care.